Welcome to the podcast. In this podcast, we discuss about the cord blood banking and how the parents can get a more accurate information from well-known doctor. She is Dr. Manjula Anagani. She is a well-known obstetrician, gynecologist and laparoscopic surgeon. She was honored with Padma Shri Award by the Honorable President of India. Fabulous role in the role of medicine, we can say. She holds a Guinness World Record by doing 84 fibroids in a single surgery and almost 20,000 laparoscopic surgeries.
So, ma'am, what exactly are the stem cells? Why are those considered so valuable in the modern medicine?
Yeah, stem cells are the integral part of regenerative medicine, where we look at restoring, repairing, and rejuvenation, replacement of the cells which needs them. So what we're looking at, we are looking at a cell which can take the form of the bone, or even a nerve, or even a blood cell, or even a endometrial or ovary cell, depending on what we need it to replace. So we are looking at either repairing and replacing the cell which we needed, or restoring it to the health, to what it is supposed to be. So that is the reason why we all hold it in a very higher level, because that is one cell which can do all these activities which any other cell cannot.
What is exactly this cord blood banking and how it is collected after the delivery?
Yeah, the cord which connects between the baby and the mother, they have these stem cells which can change the whole life in the future of the baby and the mother in many diseases where it is needed. It is so simple to collect that it is painless, and we just have to take it from the umbilical cord. No harm to the mother or the baby. That is the reason stem cell collection is something which we all look at, so that in future it is like insurance. It is like we might never need it, we should never need it, but when we need it, we have something to look about. So instead of discarding the whole umbilical cord and the placenta, reserving and preserving, which we can use it for the future.
Ma'am, is this stem cell collection safe to do?
The first thing we need to understand is when it is stem cell collection done. After the baby is delivered, we cut the stem cell, the cord nearer to the umbilicus and hand over the baby. That means the baby is safe and the pediatrician is taking care. Now there is this umbilical cord which is hanging, which is attached to the placenta, which is supposed to separate itself from the mother within few minutes, 3 to 4 minutes.
Right,
so that's a vestigial organ. So we are not harming anything, we are not taking the blood from the mother. That blood is totally belongs to the baby, and the placenta barrier is stopping it. So we are collecting from a painless umbilical cord. So it is safe, painless, secure. Mother is not having anything. We are not taking out blood from the mother. Baby is already in the pediatrician. So the safest way of doing it with nothing happening to the mother and the baby.
Ma'am, so how are these stored stem cells exactly used today, or any particular kind of conditions or disorder they can be treatable in the future?
See, we already spoke about these cells are totipotent cells, means which have a potency to form any other cell which we want it to form, depending on what the disease is. So right now, about 80 serious conditions are already being treated with these stem cells, like leukemias, cancers, thalassemias, and certain transplants also. We are actually trying it out. But there are a lot of studies which go on, and we are already doing this stem cell therapy for ovarian rejuvenations, endometrial regenerations, autisms, and even diabetes, and many more diseases to come. So I think we need to understand the growth and the potential of this stem cell therapy is very huge. Even though it's still, we call it as experimental stage, it is something for the future. The science is here to develop and get us more research and more need, and with the ethical base for the future developments.
So, ma'am, does every child need to store their own cord blood stem cells?
See, it is not about need to. It is not about wanting also. It is about, like I said, it is like insurance. You might need it, you might never need it. If you keep it, it is like having something in the back of the mind that, oh, I have it. If at all I need it, I have something in the reserve. So it's not about a compulsory thing, but it is about a choice. Having a very educated choice about why we can have it.
Understood. So, if in case, if the child who is having preserving this own cord blood, if they don't have any previous family history, does it essential to store?
See, remember one thing, in today's time, we are telling that the lifestyle and the pollution which we are having and the addictions they're going to go through, apart from the genetics, everything is about genetics and epigenetics. You have a genetic preponderance. Epigenetics is the ones which are going to take you to the disease or not. So it can be something like no exercise, dietary habits which you're having, and the addictions which you're having, stress levels you're going through, and the pollution you're going to expose yourself to. All these are very important to create a disease. And do not forget the mutation. It can come for the first time in your life. So we cannot say just because you don't have family history, you're not going to get anything. Nobody has any cancers before, but now every third person is having a cancer. So it is always better to have something, to have a choice.
So, ma'am, if the parents doesn't preserve the stem cells right now, do they have any opportunity to preserve later?
It is only when there is a second child which is going to be born. Because cord blood, umbilical cord, The name itself says it is between the umbilicus of the baby to the placenta, to the mother.
Right.
Means we can only take it and save it only when the baby is being born.
Hmm.
Once that time period is gone, it's the lifetime loss for that particular baby. But if they are going to have a next child, it will be at least 50% for this baby and 100% for that baby and 25% for the parents which are there. So birthing time is the time to save the umbilical cord on stem cell banking. So they should be prepared antenatally whether they want to go in or no, according to the knowledge. So preparedness and having an educated knowledge about umbilical cord banking is very important.
So, ma'am, in this point of view, at what particular time of their pregnancy they can take the counseling on this kind of stem cell banking, which you would prefer?
I prefer they have to take it around 28 weeks after that, because viability in India, still we say it is 26, 24, but I think the outcomes are much better is after 28 weeks. So at that time, you can be prepared for a healthy baby coming out. So talk to your doctor about preparedness of birth and preparedness of stem cells, whether it is needed, not needed, about everything. And it is always really better to be prepared for it and have a biological insurance in the form of saving the umbilical cord.
As a doctor, you hear most of the misconceptions parents understood
True.
regarding on this stem cell
True.
bank. So, what are the most misconceptions parents
See,
usually use?
when we were children, we used to hear the same sort of thing with the regular insurance. Oh, if I take an insurance, I will die. It used to be that sort of a myth. The same thing here. It is not necessary. It is unnecessarily being stored. Waste of money. Our family do not have anything. So why should we store it? So it's not about having it. Like I said, it is about getting prepared for untoward events which can happen and how to be prepared for such events when it happens. So it's a safe. It's about little bit of money, but it's not going to be painful. It's not hurting. It is something which will keep a peaceful mind and happy sleep. So I always advise that in our generation, we never had something like this.
Right.
So next generation, I think, should be looking at, now when we look at so many insurances, health insurance or life insurance, endowment policies, we have to look at this is a biological insurance.
Exactly. So, ma'am, if in case we can consider in this biological insurance kind of this, how can the parents decide whether we can go for it or not? Because biological insurance, maybe they consider it as maybe second kid I can choose, or maybe first kid I can consider it is not done, something like that.
See, what we need to understand is for that baby, it's going to be 100%. So you want to give substandard thing to that baby. If you have two children, it has to be two different things to have a 100%. Otherwise, the other sibling will have only 50%. See, this is how the whole stem cell thing started. When the first child had a disease, that's when parents went for second child and umbilical cord, this thing. That's how the whole revolution of stem cell therapy started, when that umbilical cord blood cells were utilized to treat the first baby with the disease. So the revolution said that this is better if we can give for the 100% for the child, that actually typing will be good. So please think that you want to give 100% to your child. Please save your umbilical blood cord or stem cell banking for both children.
So for this, they need to get the counseling done and they need to understand what exactly the stem cell banking works and how it works. Stored, what are the accreditation they should have.
Which stem cell banking they have to take is a different question. Exactly. That's where you need to understand, talk to 2-3 companies, whichever is deserve you, then check their accreditations. What were the things they were doing before? Did their stem cells be utilized for some other diseases? And what were the results of that? But those things are very important. Are there public cord blood banking or a private thing? So will my cord blood be utilized for some other people? Will it be stored only for me? All those things they should be asking to that particular company, then take a choice.
So, ma'am, like in the future days and now also, many more advanced treatments are coming. In that way, if we can consider stem cell banking as an expensive one, how parents can look over it?
See, first thing is when we take insurance, we talk about health insurance, you take 1,500 rupees or whatever, 10,000, then we are taking insurance for how many lakhs? 50 lakhs, 1 crore, whatever. Okay, that is the way we should be looking at. Any treatment with advancement is all about technique and technology. Technique still is cheaper, but technology is very, very expensive. So more and more we need these treatments. It's going to be much more expensive than what we have done to save this and store this. Now, many of the companies are now coming forward and telling that there will be financial assistance if need comes. So that is very important. So you might never need it. That's it. This is the limited amount you have paid. But if you need it, financial assistance will be given by that company. So when you're thinking of which company to go, you should be looking at that also.
If in case of the doctor point of view, if like parents come to you and discuss about my doctor is not suggesting. In case of we go out, some of the people are saying that doctor is not suggesting. How can a doctor play their role in this kind of suggestions?
In this world of distrust, now there is the link between the patient and doctor has become very, very flimsy, and it is about trust. Patients no longer trust. They think there is some financial gain the doctor is going to get. And doctors just want to concentrate on healthy mother, healthy baby. So this is not a part of healthy mother, healthy baby. So it is something which parents have to take proactively a decision regarding about their future.
Exactly.
Yes, it is available as something which a doctor can tell. But suggestion is something which a doctor cannot proactively tell. If they come and ask us, this is what we heard, can we take it? Yes, definitely you can take it, but it is totally your choice. That is something they have to understand.
Is it mandatory to take?
I would suggest that it is not mandatory, but it is advisable to take.
Okay. If they want to preserve, you can suggest them as a long term or short term.
It has to be a long term because we are not looking at living only 20 years. We are looking at living for 70 years, 80 years. That's what we should do with our child.
If in case they want to go with the second baby and they don't want to consider with the first baby, what you usually recommend?
Then I feel that is only 50% viable for the first baby. So it is like you're doing injustice to the first baby. If you're going, it is always advisable for both. But if you miss the first child, definitely do it first.
Okay, what is the right time to take the decision?
7th month is the right time. Because viability time is that.
Where should the parents exactly look to consider which stem cell banking is most worthy?
Go into the Google. Please use the social media. Go and look into that particular company. Look at the internationally acclaimed accreditations are there or not. All the safety precautions are being done or not. And then only go.
If in case you have a minute for your patient, you can say about stem cell preservation, about their baby's cord blood preservation. So what is that one line or what is the particular thing in 1 minute you can discuss with the parent?
First, in India, we'll always talk about the cost. So if money is not an issue, the safest, simplest and the best way to save and secure your child's future would be stem cell bank.